So we'll be going live in 3, 2, 1. So we are live now, so we can go ahead.
Good evening. Warm welcome to the second session of Indian Orthopaedic Association on prevention and healing for burnout of the healthcare professional. This program is jointly organized by Indian Orthopaedic Association and INDEAR. To give you the introduction about INDEAR, it's a non-profit organization run by the healthcare professionals, mental healthcare professionals across the globe. And they did exemplary work during the COVID pandemic. They look after the well-being of essential care workers, not only the doctors, but the nurses, a lot of staff, a lot of police people who really served well to the society during pandemic. So we are really thankful because this India provided us the faculty, the expert on the subject. We discussed last time and we realized that there are a lot of articles coming from even India also, which says that burnout is not only a hypothetical situation, it's a real situation. And the incidence of burnout is around 30 to 40% across the specialty, whether you take it intensive care, whether you take orthopedic surgeons, in almost every specialty, the incidence of burnout is around 30 to 40%, which is really a high number. And poor mental health of the healthcare professional leads to a lot of problem. The first is it affects decision making. The second, the problem in decision making leads to a lot of complications during the treatment that results into poor outcome, leads to dissatisfaction to the patient and to the doctors also, and sometimes malpractice sue. This affects not only the doctor, but it also affects the colleagues, the team members, and even family members. So burnout is a problem, and this session, the last one and this one, is a small step taken by Indian Orthopaedic Association, and I'm sure that it's going to have a huge impact on this. At this stage, I must appreciate the support which we received from the president of Indian Orthopaedic Association, Dr. Sivashankar, and the secretary, Dr. Naveen Thakkar. When I suggested we need to do such program for our association, they immediately accepted the proposal and said that, Dhiren, you go ahead. And because of their generosity, because of their willingness to help our colleagues, we are able to carry out this program. Let me introduce our expert faculty. We have two experts from USA. The first is NC Lewis and second is Gitika Talwar. The brief introduction about them is NC Lewis is a licensed clinical social worker. She is assistant director at Fordham University in New York. She is co-founder of Velocity Vision Incorporation, which works for the personal and the professional development of professionals. Over and above that, she has a keen interest in prevention of burnout and compassionate fatigue, which are very related to all healthcare professionals. We have another expert, Gitika Talwar. She is psychologist in Seattle, Washington. She did her doctorate from University of Maryland and master's in social psychology from Mumbai. Again, she has a keen desire to help healthcare professionals to fight against burnout. We have equally experienced panelists. We have Dr. P.N. Gupta. He is professor of orthopedics at Government Medical College, Chandigarh. This time we have one more panelist, Dr. Vivek Trikha, who is trauma surgeon, orthopedic surgeon at All India Institute of Medical Science, AIIMS, New Delhi. We have Sannesh Tuteja. He is orthopedic surgeon, specialist of arthroscopy and arthroplasty in Mumbai. And we have Dr. Padma Singhi. Dr. Prahlad Singhi, because of the illness in a close relative, cannot attend this session. And in his place, his wife, Dr. Padma Singhi, who is a dentist, will be participating in the session. So welcome all the panelists. In the last session, we discussed about what is burnout, what are the symptoms of burnout, how to make a diagnosis, and we discuss about the assessment tool, which is Professional Quality of Life PROQOL assessment tool. We have circulated the link for the PROQOL assessment in the flyer also. In today's session, we are going to discuss about the causes of burnout, how actually this causes leads to the changes or the effect on the doctors, what we can do to prevent it, and the most important thing, if it has started, then how to prevent the progress and how to reverse it. So with this short introduction, now I hand over to our expert. If you have any question, please text message me or WhatsApp your question on 97129 25600. Again, I repeat, 97129 25600. You can take a screenshot of this so that if you have any question, you can WhatsApp or you can text message your question to me. With this, over to you, NC. Thank you.
Thank you very much for that introduction and for having us back to present on session 2 to continue the educational background about burnout and how to prevent it. And I want to say, as I said last time, I am very grateful that we are able to present on this topic, because one of the major issues with burnout is that it is considered a stigma for anything in the emotional realm that could affect healthcare professionals, but it does lead to many issues. So just the fact that we're having this presentation will start on the road to better outcomes for healthcare professionals and the patients that they serve. And quickly to tell a little bit more about me, I have 20 plus years of experience working as a social worker. I've worked as a professional with all different types of populations, including vulnerable populations, as well as those in the healthcare profession. And burnout is very real. It's something that I have faced and also my colleagues. So we have to, on a daily basis, do the work to prevent ourselves from being overwhelmed by it so we could serve at our best capacity. I am also going to give a moment to my co-facilitator to introduce herself, and then we can start with the slides.
Hello, everyone. Once again, my name is Gitika, and I serve as a psychologist at the University of Washington, where I serve students. But I've been in the field of mental health since about 2007 or before that. And in all the years that I have worked with different communities, what I have recognized is that we as professionals who serve communities, whether it's through the pure medical field or mental health field, we are very important resources for our communities. And whenever folks like us burn out, it is the community that suffers. And it's by watching the pain of our communities over time that, and the endless work that service can be, that ends up being the cause of burnout in some ways too. But it doesn't have to be the final story. By taking care of our burnout and being able to show up for our communities, it's one important way that we serve our communities in the long run. So I'm really excited, and I echo what Ansi said about the importance of this conversation. And it's definitely an important start so that we can keep doing the good work we do and do it long term.
Okay, wonderful. So we will be pulling up our presentation, and then we can get started. A little bit about the presentation is that we use interactive discussion, as well as we invite those who are on the panel and those who are watching, who are not in the live Zoom room, or who are watching on the recording, to try as much as possible to participate in the exercises, because there is a lot of benefit when the exercises are done and not just discussed about. But we ask you to be open to a different way of presenting and learning that we think will be very valuable. So we are here for session 2. We're going to do a brief review of session 1, which is not to repeat what was already said, but to just add on a little bit to that. And we introduced ourselves, Ansi Lewis and Gitika Talwar. So the overview of today's session will be a brief review of session 1. We are going to get into the causes of burnout. The neurobiology of stress and burnout will be discussed so you understand the science behind it. And then more strategies to address burnout, because the more strategies that you have, the more tools you have in your toolkit, the better you will be in preventing this from happening to you, or being able to become resilient if you find that you're already in the beginnings of burnout. And long-term prevention. We're going to talk also about how we could possibly start bringing this to an organizational framework, but it all begins with self and taking care of self. And then from there, community and organization can become stronger, but it starts with self. So we're going to be focusing on self and then talk at the end about how we might be able to bring it to a larger context. Next slide, please. So Geetika, you could take over from here.
Yes. So I'm just making sure I know where my mute button is. Yes. So a quick review of the concepts we'd gone over in session one. One, of course, we wanted to revise the definition of burnout. I mean, revisit the definition of burnout. Burnout is a syndrome conceptualized as resulting from chronic workplace stress. Most importantly, stress that has not been successfully managed. Stress is inevitable, but how you manage it is the key. And it is characterized by 3 dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job, feeling cynical or negative towards one's job, and overall feeling a reduced sense of professional efficacy. How good am I at doing what I do? So that professional efficacy ends up feeling reduced. Then we went over the concepts of compassion satisfaction, compassion fatigue, secondary traumatic stress, and burnout. And we were measuring that using the ProQual, which we discussed last time as well. So compassion satisfaction was understood as something that ends up buffering the effects of compassion fatigue and secondary traumatic stress. And compassion fatigue, secondary traumatic stress combine to create feelings of burnout in people. And the final thing was that we talked about the prescription of self-care, self-compassion, and finding the good in your week, finding those small wins, the big wins, everything that helps you feel good about your week. And we had also prescribed in self-care, we prescribed the tripod of wellness, which is ensure you're sleeping well, eating well, and getting physical movement, physical exercise. So we'd gone over these concepts last time, and we'll go a little deeper into the causes of burnout today. So in causes of burnout, I follow the work of Christina Maslach, who is a psychologist, and she has also created a burnout inventory, which is different from the ProQual in what it measures, but it also gives a very good account of what burnout can look like. But in her research, she talks about the causes of burnout coming primarily from workload, when the workload does not match your capacity. And mind you, it is sometimes workloads don't match human capacity. And reminding yourself that a human cannot be expected to do this much. Sometimes the workload, when you start recognizing that it's outpaced your human capacity. Control, when you lack control over your working style or the work demands that keep coming at you. And reward, when you don't feel like the benefits you get from your work are matching the effort you're putting in. Could be that you're not happy with your salary. It could also be that you don't feel like patients are healing in the way that you'd hope to. So whatever joy you can get from your work, you're not really getting. You're only putting in a lot, but you're not getting much in return. Community, when you feel disconnected from others. Could be you feel disconnected from friends and family. It could also be that you work alone so much that you end up also feeling disconnected from your colleagues. Maybe you're the only person who does what you do, so you don't even sometimes have other people to consult with, and you end up feeling really disconnected from just your social connection at work or home. And because humans are very social species, this actually hurts us on many levels when we feel disconnected from others. And then fairness, when you perceive a lack of equality with perhaps others who do the work you do, and you end up feeling like some people end up getting maybe more benefits, or they end up maybe getting a better work shift, or maybe they even seem to be doing much better. Sometimes the lack of equality could also be other people you compare yourself to. Sometimes in families, we compare ourselves to each other. Sometimes from the people we went to school with. One can sometimes feel like, oh, I'm a doctor and I'm, this is the life I have. But so and so, he went and he just started the family business, continued that, and he has a much better life than I do. So even when that sense of lack of equality starts setting in, that ends up also affecting one's sense of, uh, fairness, and it ends up causing burnout as well. And then when there's a mismatch between your values and those in your organization or of the people you serve, this can especially be true when you find yourself saying the same things over and over, but you realize that the folks you're serving don't seem to share your values around what is important in their life. And you as a doctor might sometimes know what people need to be doing. And when they don't seem to be doing it, it can end up feeling extremely thankless. And that value mismatch can also end up affecting people's sense of satisfaction from their work and causing burnout, of course. So how does the burnout how do these causes actually end up working on you? I think one of the important things for us to recognize is that there was a time that it was assumed that the brain is very solid and it doesn't really change. But of course, over the past few decades, it's become clearer that the brain is they talk about the neuroplasticity of the brain. The brain is kind of malleable. There are some specific parts of the brain that have specific functions, but how it does those functions is constantly evolving. So the triune brain, I explain it very simply as if you actually look at your brain like this fist. The thumb is the reptilian brain, so it's the one that's most inside, and it's the one that develops first. It develops when a person is still in the womb of the mother. So it's the most primitive part of the brain, and it's the part of the brain that we actually share with animals, with bugs, with reptiles, everything. So this part of the brain forms first, and it's responsible for your survival. It's constantly scanning the environment for danger. And then you have this other part, that's the mammalian brain. This is the part of the brain that's responsible for your learning, your memories, and it's also the place that experiences emotion. All our emotions serve a purpose. When we are happy, that serves a purpose. When we are scared, that serves a purpose. Anger, all of that serves a purpose. So this part of the brain is taking care of emotions, learning, and all of that. And then there is the most rational part of the brain, which is also sometimes actually called the monkey brain. You can call it the human brain if you like, but it's also the most advanced part of the brain. It actually keeps developing, and our brain fully develops only by the time we are 25. So this most advanced part of the brain is extremely logical. It can think ahead. It can imagine. It can be really creative, and it's responsible for our organized thinking. What ends up happening is that when the fear-based brain is active, let's say you are looking at something dangerous, or even when you're driving a car and you suddenly need to apply the brakes, you don't think, oh wait, that's happening, I should apply the brakes. You actually act really quickly. That's this part of the brain. It's very quick. It's constantly scanning. So the thing is, when this part of the brain is active, the rest of the brain, it's like it goes offline. So a lot of times when fear is alive, the rest of the brain is going offline, and we are not getting to use our logic. So when people are really emotional or they are really scared, if you try to tell them, oh, calm down, just calm down, and you try to reason with them, it may not work. You actually have to help the fear response calm down. The fear response sends signals to the body to fight, flight, or freeze. So fight, anger; flight, so escape; freeze, stop, don't do anything. So there are some people who seem like when they are in panic, they don't seem to know what to do. They become really shocked, or they seem to be really still. That's actually a very natural human response. So the thing is that when fight, flight, freeze is on, signals are going to the body to act accordingly. Fight, flight, freeze, signals are going to the body. When you actually calm your body down, this part of the brain calms down as well. So that's the whole idea, that you actually need to reduce the fear response by helping the body come out of fear. And this triune brain will be a very important part of the next slide as well. So I'll definitely come back to it in a minute. The other thing that I wanted you to understand about the neurobiology of stress is the autonomic nervous system, which is divided into two parts, the parasympathetic and the sympathetic nervous system. Treat the sympathetic as it's sympathetic to stress. It's always thinking about what to do about stress. So it's constantly in that reactive mode. Even the small things that we do in our everyday life, it's thanks to our sympathetic nervous system. It's constantly helping us react to the world. The parasympathetic, on the other hand, is the rest and digest system. It acts up when the stress has passed. It helps the body calm down. The thing with the parasympathetic nervous system is it's a bit like that person who's always waiting for other people to stop talking before they talk. And sometimes other people never stop talking. So that person, that quiet person, never talks. So the parasympathetic nervous system ends up actually sometimes not acting up because the stress doesn't seem to pass. And most crucially, something I had also said at the last session was that our brains, they don't distinguish between imagination and reality. If you imagine yourself on a vacation, there is some pleasure you experience. If you really go into that experience, there is some pleasure you experience because the brain is able to recreate that and send signals to the body about like, oh, I think we're on vacation right now. Won't be as great as actually being on a vacation, but it works. So the parasympathetic nervous system does not act up also because the stress response is alive also from the thoughts that you constantly have. So when the causes of burnout that I went over in the previous slide, when there's so much going on that's not exactly work related, but is affecting your work, those are all thoughts that are creating stress as well. So the stress response is constantly active and the parasympathetic nervous system is not getting time to actually do what it does. Your body can naturally relax if the parasympathetic nervous system thinks that the stress has passed. So I know that's a lot of information. So bear with me. I'll go into it a little more and then, of course, just check in with how folks are doing. So continuing with the neurobiology of burnout, when I was telling you about the three parts of the brain, now I'm talking about this part. When there is exposure to persistent uncontrollable stress, that has a negative effect on the prefrontal cortex, which is the executive of the brain. It's responsible for logic, rational parts, and it thinks and acts. It thinks and acts, okay? It's not reactive, it thinks and acts. So when you are dealing with low sleep, and also when you're exposed to persistent stress, the neurotransmitters that are released, dopamine and norepinephrine, those end up actually lowering your overall PFC activity or prefrontal cortex activity. And the next slide actually is a more detailed expression of what happens when there is strong PFC control. That's the executive of your brain is able to manage what you do, versus there's weak PFC control. That's when just the stress and the lowered activity make sure that your fear is the one that's making decisions. So when there's PFC dysfunction, you're likely to be forgetful. You're likely to have very concrete thinking, not very imaginative, very just do it this way without being able to actually think about things creatively, which of course has potential for medical errors. There can be difficulty concentrating and disorganization. Because the PFC's job is also, there are 1,000 things, I don't know if we always realize, but there are a million things trying to grab our attention all the time. The task of what to pay attention to and what not to pay attention to is actually the executive's job. So when you are having difficulty concentrating and you're disorganized, it's because the executive is so tired. The executive is like, lao, sab kuch lao, like, pay attention to everything, but then it's foggy. It's not going to make very good decisions, and that is going to impair your decision making. Then there's reduced insight, of course, as a result. You're not able to think big, right? Judgment and moral conscience, because you become very survival oriented. You just become about, I just need to survive today. So the moral conscience that says, is this right? Is this ethical? sometimes that lens becomes really weak. It's the executive's job to think about ethics. And if the executive is weak, the moral conscience is impacted as well. And of course, that'll affect your ability to empathize, to be compassionate towards yourself and others. It can lead to decreased optimism. Since you can't imagine anything other than the stress that you're witnessing, of course, you'll end up reducing sense of optimism because everything you're looking at brings you down. So you end up believing this is probably the only way it can ever be. And self-regulation, inhibition control, that's again connected to that, what to pay attention to, what not to pay attention to. In your impulses, should you focus on everything that your impulses tell you to do, or should you also decide what's most effective? So overall, weak PFC has been associated with some very concrete clinical consequences. And that's another reason that focusing on burnout has become really important, because they've started actually noticing the very serious implications of lowered PFC activity, and how that can affect medicine. So before I go into the strategies to address burnout, I know that was a lot of information. I just wanted to check the chat or also see how folks are doing with this class.
Yeah, I have a question from audience.
Yeah.
Shall I take that question at this stage?
Sure.
Yeah, the question is like, shall we start all this preventive strategy which we are going to discuss at early age or after 45 or 50, when actually the symptoms of burnout, they starts appearing?
Mm-hmm. If I can just address that really quickly, also, and I'll hand over to Ansi too. It's a bit like asking, should I fill petrol in the car when it goes to reserve? And should I wait for my car to break down before I take it for repairs? Our mind and body are precious. Let's not wait for it to break down and then build it up, So that's what I have to say about that. But I wonder what you'd like, Ansi.
I am in a complete agreement with that. And I also want to say burnout does not bias by age or race or nationality. Burnout is a human phenomenon recognized by the World Health Organization. So it can happen to you in your 20s. It could happen to you in your 30s. So it's something that you don't wait for, you start now, during this workshop, after this workshop, to implement strategies for good health, because it can benefit you at work and, with family and personal life as well. So never wait on your health. Is there another question?
Yes, there is another question. You describe a lot of causes. Now, are they related to the over expectations from the profession, that we are expecting that profession will give us a lot of prosperity, lot of respect, a lot of name, lot of fame? So we expect, we enter into the medical school with that idea that being a doctor will give me a lot of things which everyone wish. So when these expectations are not fulfilled, we start feeling that, oh, I expected something, but reality is different. So is it the reason of burnout? And if that is the reason, in that case, what a medical student, or before getting into the medicine, they do is they shadow the doctor. They see the life of real doctor, which is not the case in India. So do you think that that will probably prevent this problem?
I will comment to expectation, and managing perspective is a big preventive factor for burnout or other emotional impacts. Because when we are looking at something in one angle only, it can be very limiting. So whether you're shadowing or whether you are doing the work right now, it's very important to manage your perspective. And we're going to be doing some exercises later on in this session to talk about how to manage the perspective. But yes, that is a contributing factor, but not just for the profession of medicine. If you notice in your life, when you have held on to one view, one expectation, and it is not met, whether that be in your personal life, maybe the grades you wanted in school, maybe the person who you wanted to be friends with didn't want to be friends back with you. Wherever you hold one limited perspective, it can be devastating to your emotional health. So I think it's beneficial to take what we call managing your perspectives in order to help prevent burnout and other kinds of emotional distress. I don't know if Gitika has to add anything to that.
Just +1. That's great. Yeah, I think that was perfect. So let me go back.
Just quickly, also shows the audience is aware of some of the factors that is affecting them. And we will talk about practical tips on how to manage those things.
Awesome. So yes, I'm going back into the presentation. And we're going into strategies to address burnout. Of course, this is in addition to, what we were discussing last time. It integrates with what we discussed last time. The first thing that I often share with the folks I work with is the serenity prayer. So serenity prayer actually comes out of Stoic philosophy, and it's made most popular by Alcoholics Anonymous because they encourage folks to say this prayer. And it's essentially, grant me the serenity to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference. And that final line ends up being where most of the work is. But it's definitely an invitation to you to consider what are the things in my control and what are the things that are not in my control, so that I can choose where I put my energy. If you keep trying to break something that is not completely in your control, decide how much effort you want to put into that. Because the more effort you put, the more reward you'll expect. And if the reward's going to be poor because that thing is beyond your control, it's going to affect you. So I definitely invite folks to internalize the message from this serenity prayer. And then, of course, identify what is the cause of burnout for you. Is it your workload? Is it the sense of control? Is it the reward system? Is it everything? And then installing more parasympathetic nervous system activity. Like I was telling you before, the parasympathetic nervous system is waiting for a cue from you. And if it's not getting it, it's almost like a muscle that is not getting exercised enough. So you have to manually exercise that muscle, the muscle in your brain, the parasympathetic nervous system, by actually doing the things that help the parasympathetic nervous system, slowing down, taking time to eat. Even if it's you have just 10 minutes to eat, focus on your eating, chew slowly. But slowing down is one real concrete way that you can help your parasympathetic nervous system. The importance of sleep was also coming from exactly this. Sleep is the most beautiful parasympathetic activity that you could do. And making sure that your sleep is restful is a gift you can give yourself. And the self-care, making choices about areas where you have control, such as self-care, end up also in helping with your parasympathetic nervous system activity quite a bit. So choosing actions that help you very consciously relax ends up helping with your parasympathetic nervous system. And the most important, this concept that's discussed quite a bit, especially in the US, is mindfulness. And it's almost amusing for me to be talking about mindfulness with an Indian audience, because mindfulness came from India. And mindfulness, the original term for mindfulness is smriti. Smriti means to remember. And it's over time, of course, become mindfulness. And there are so many aspects to mindfulness. But one thing that I've learned from some of my teachers is mindfulness can be about treating your attention like money. Be careful with how much you pay. And I know how careful I am with my money. So why will I pay with attention the way I wouldn't pay with money? And the amount of conversation that is there on social media being used to market and everything is because your attention is really valuable. it is a valuable commodity, and we need to use it like a valuable commodity as well. So the idea is also to bring your body and mind in harmony to the present moment. The European and American medical systems had talked a lot about mind and body being separate, but there is an increasing realization that actually the mind and body are really connected. So bringing your mind and body in harmony to the present moment through some acts of smriti are also great opportunities to help yourself. Mindfulness and the way it has also been taught in the West has also, they have tried to make it very secular because they had to make sure that it could reach all audiences. So the definition that was adopted for research purposes and then practice purposes is paying attention in a particular way on purpose. So using your prefrontal cortex, so on purpose, in the present moment, and non-judgmentally. Nothing is good or bad. It is what it is. This plant in front of me, it's neither good nor bad. It is what it is. So paying attention on purpose in the present moment and non-judgmentally. So the person who's most known for the research and actually introducing mindfulness into the medical community in the West has been John Kabat-Zinn, who's also the executive director for mindfulness and meditation in medicine. And in fact, he developed the mindfulness-based stress reduction course that ended up being used in pain medicine. And he's, of course, globally renowned for that. So part of my experiential exercise today was actually to lead you to through a small way of practicing mindfulness every day. It's important to me to help folks recognize that mindfulness is not necessarily, this practice doesn't have to be something that I do quietly in one corner when I have nobody's going to bother me. Mindfulness is effective when we can take it off into the world, doing the things we do with mindfulness. So a very tiny way that I do that is through an exercise that I would invite the audience to practice along, and recorded or live. So like I said, smriti is really to remember. And I invite you right this moment to actually bring your mind and body to this moment by noticing yourself breathing. Your breath is always with you. Notice yourself inhale and notice yourself exhale. Feel the breath go into your belly. Feel the breath leave your belly, your stomach, your lungs. Notice again, inhale. Feel the breath enter your nostrils, your lungs, your stomach. Exhale. Notice the breath leave your stomach, your lungs, your nostrils. This moment, this one, right now, is the only moment that is real. And notice the thoughts going through your mind, and then bring your mind back to your breath. Notice the sensations in your body, your hands, your feet, your stomach, any tension. Just inhale, exhale, and let it go. And whenever you feel ready, you can come back to the screen And we'll go into the next slide and just notice how it feels to pay attention in this new way after breathing. And I'm handing over to Ansi.
Thank you, Geetika, for taking us through that exercise. I know when I focus on my breathing, I always feel more calm, and it helps me in my presentations so that I don't become too nervous as I present. So I use it in the moment. I want to add on and complement another technique to what Geetika shared. And it's a strategy that is, when done properly, can be very powerful. It does not take a long time. And when it's done on a regular basis, it helps prevent feelings of overwhelm. It brings more joy. It helps you feel more content. And it, according to some of the articles that I've read about this concept of savoring, which I'm going to describe, it lights up in the brain the pleasure centers. Even if you're not engaged in a physical activity that's pleasurable, if you are using the savoring technique, your brain starts to feel pleasure in that moment. And so it's really, savoring is, simply put, taking in all aspects of the positive. We are, especially in the United States, I could speak for, we are always very busy. There is no time for anything. And there's almost an emphasis put on being busy is a badge of honor, which is not a good thing because it contributes to burnout. We don't take time to stop and savor the good. And in prevention of burnout, savoring the good moments are a big key factor in being able to stay present with your patient, with your client, and being able to feel effective in your work. And when you are having trouble finding moments to savor, then there's this technique called hunting, where you have to go hunt for that positive, even if it's small. And big or small, savoring these moments are going to help you feel that sense of pleasure and lead to compassion. Satisfaction, which we talked about in session 1, is a protective factor against burnout. So I want to take us through an exercise, which will only take a few minutes. What I ask of the audience, whether it's the panelists in the room or those who are watching or those watching the recording, is please take these next few minutes to actually participate in the exercise and some of the guidance that I provide, because you will feel the effect if you go through the process. So for those who want to blank out their screen, you are welcome to do that. If you are comfortable, you can close your eyes. I ask you to now bring up a memory that was one of joy. The big key with this, bringing up the memory, and I'll give you a few seconds to do so, is to try to bring up a memory that is absent in that moment of negative events or negative feelings. So the memory could be anything that brought you joy. It does not have to be a huge, big accomplishment. It can be if you want it to, but it doesn't have to be the moment that you graduated from medical school, or it doesn't have to be when you achieved a great accomplishment. My memory that I bring up, that I use for savoring, is a memory of my son when he was 2 years old, and I baked him a homemade cookie, and the look on his face and the enjoyment and pleasure, that memory serves me well in terms of savoring. So I ask you now for a few moments, I will give you to please bring up a memory that brought you joy. And as much as you can, bring up a memory that is absent of negativity in that moment. So I'll give you a few seconds for that. Now that you have that memory, I'm going to ask you, either with your eyes closed or open, however you can, think about all the positive and wonderful images associated with that memory. If you want to close your eyes to really lock in that feeling, please do so. And for several seconds, I want you to recall from that memory either the sights or the sounds, the colors, all the sensual images about that memory that felt good. So take a few seconds to do that now. If there are negative moments associated with memory, you could just ask them to pass along and go back to the positive images of that memory. Now, I'd like you to pull up with that same memory, in addition to the images, colors, or laughter or feelings, I'd like you to pull up all the wonderful emotions connected to that memory. So now you have the visual, sights, sounds. Now bring up the emotions associated with that memory. And let's just sit with those for the next several seconds. Now, I would like you to combine the images, the sights, the sounds, the feelings, and add on to that all the positive thoughts associated with that memory. It could be, I'm very proud of this moment. I'm very joyous. I'm grateful. Combine those three areas, the thoughts, the feelings, and the images. And let's take several seconds to really marinate in that. If any negative emotion or feeling comes up, you could ask those thoughts and feelings to just step aside for now and take in all the positive aspects of that memory. So now picture that all the images, the thoughts, and the feelings, the positive ones associated with that memory, are absorbed into every cell of your body, and they are there for you whenever you need them. And if you could picture a light that showers from the top of your head and washes down through your shoulders, your torso, your legs, and down to your toes, that locks in all those positive feelings associated with that memory. Take that in for a few seconds. So now you have all those emotions in your cells of your body that you could access whenever you would like. So if you could just come back to the room, if you haven't fallen asleep. I know that when I've done this exercise, I've had members of the audience fall asleep because they are so relaxed. And this is a way to access that part of the brain that Gitika was talking about and light up not only the pleasure zone, but also a relaxation part of the brain and being more in the parasympathetic. Now, that was a few minutes. I want to just say, savoring can be done that way in terms of several minutes, but it can also be done by hunting in your environment on a daily basis and savoring the good things that happen. I will be in parts of New York City sometimes where parking is really impossible. If I get a good parking spot, I savor that. That sounds very silly, but as you savor all those little things along the way, you are preventing yourself from stress and the add up of stress. Each time you add those drops into the bucket of stress, it fills up and then it overflows. But if you keep adding drops of savoring, then your bucket of compassion can overflow. Your compassion to self and your ability to maintain a steady and complacent mood despite all the stressors in life really does make a difference. And I know in my work, sometimes I have been faced with big challenges, which I know medical professionals, and especially now with COVID in the front line, you are faced with some really heavy demands. And this savoring in the moment can really help you withstand that pressure. So I had times where I had to work in a very vulnerable and stressful environment in the nursing homes in the United States. And there was a lot of patients that I had to serve that were in different forms of mental health and physical health that were very disturbing to watch and to work with. And I remember that I felt defeated sometimes because I felt like my work wasn't effective. And then one day, one of the patients in the nursing home that I work with, who used to stay in her room all the time, started to come out and join the games in the main room. And one of the nurse's assistants came to me and said, I don't know what you're doing with her, but she's leaving her room and she's participating. And that, I savored that. I savored that in order to be able to then withstand the other parts of my work at the nursing home that were much harder to handle and work with. And it helped me last there for a good 2 years and to do the work at the best. But if I only focused on the things that didn't work, it would be a very devastating type of work and environment to be in. And most of it comes from within for me to be able to withstand that. And then I asked, when you savor, that you use several seconds of savoring. So if you had something good happen, a patient thanked you for your support, you savor that for 6 seconds. We are in, and I think this is happening globally, we're in a society where we're always busy. We don't have time to even savor, but they say if you even have 6 seconds to savor something, it could help lock it in. So I think we all can manage 6 seconds to savor something. So I encourage you to do that throughout the day. I think there was a question. Is this, how do the gratitude exercises, this time savoring exercises, differ? So very good question. With the difference between the gratitude and the savoring is that they can work hand in hand, but they are different. So gratitude is recognizing the appreciation in something, and savoring is feeling the emotions with it, the thoughts behind it, and holding on to it longer. And so so they can work hand in hand. You can be grateful for something and then take that thing that you have gratitude for and sit with it and savor it. So, and a big part of this is it doesn't have to be big. So that's what we talked about, the expectations and managing perspective. Even my son eating a cookie that I baked at age of 2 brings me so much joy. And that state of mind will help me when I go into stressful situations. So remember, it doesn't have to be big. The big things are good, but even small things can be savored. And this exercise on a regular basis will help build resiliency. Was there another question?
Yeah, there is a question. Like the example which you gave is your personal experience about your 2 years child getting the cookies for the first time, or like you baked it for your son. So whether that personal experience or savoring that personal experience will help in prevention of the professional burnout, because both are different compartment. So are they interchangeable, or like that personal experience also helps in professional burnout prevention?
Yes. Very good question. So what you're doing with that technique is bringing up the parts of the brain that will stimulate the parasympathetic. So whatever emotions and memories that will help you trigger that part of the brain is what will help you. I used my example because that memory brings me a lot of joy. If I want to get into that state of mind, that's a quick way for me to do it. I could bring up also professional examples. I savor, right now I work with graduate students. Sometimes it can be very challenging, especially with COVID. A lot of the impacts on the graduate students and their practicums and practicum sites shutting down is very stressful. They pay a lot of money for tuition. When I have a student who thanks me amidst all the complaints I get, I savor that time that the student gave me a thank you for working with them and helping them, even though this time is tough. So it can be a professional example, it could be a personal example, but the key here is to savor what will help you access that part of the brain that will bring you into parasympathetic, that will bring you into the pleasure areas of the brain, because that's when we do our best. When we start to trigger the part of the brain that Gitika talked about, that is emotional and is not open to the creativity and problem solving, that's when it leads to more burnout. And when you open up those parts of the brain with whatever memory you pick, you are able to be more creative and problem solving, and that prevents burnout. And it also opens up your ability to be compassionate to others. There was another question. Oh, okay. Is there any others?
Yes, Dr. Trika has a question.
Yeah,
Sure.
it was just before this also that we were discussing regarding the parasympathetic and the sympathetic chain things around this burnout. So as a scientific person, many of the doctors will be feeling that, can the medications help us in this? If we can control the parasympathetic or the sympathetic pathways, as we do for many of the other cardiogenic or any other things, fear and fight, we are always trying to control. So how much part can be done by medications, or it's purely the cognitive and the behavioral things which we need to think of in a burnout rather than the chemical or the chemo aspect as a scientific person?
I think that's a great question. And one of the things that the research continues to show is that the combination of cognitive behavioral therapy and medication in the short term is what helps with syndromes that have a very strong mental health component. Also, when the medication is used, it needs to help in the symptom reduction to the point so that the person can install good behaviors. Otherwise, it's a bit like you're going to keep injuring yourself again and again, and you're putting a band-aid on it again and again. I think medications are very helpful and they're very important, and they help definitely. They take the pressure of the mental health symptom down so that you can install all these things and get some benefits from them. Otherwise, it can feel like I'm so burnt out and the savoring is not going to help me get out of this burnout fast enough. So to give you some level of hope and to keep the push to do the right things, to keep that push going, medications end up helping in that symptom reduction. But lifestyle change ends up being really important also, because otherwise that will keep happening. And also the ways that you're thinking, because it's so intricate, if the ways that you're thinking are contributing to your burnout and the way you're approaching your life is contributing to your burnout, your medication is not going to make you happy. It's going to reduce the effects of the burnout. It's not going to help you experience joy. That is something that I've seen again and again with patients of mine I've worked with, that they are like, the pain is less, but I can't enjoy music the way I used to, or I can't enjoy my life the way I used to. So I think there are limits to
So if I can say
rely
that,
on.
it's like that for reducing our pain and for reducing the symptoms and the signs of the burnout, we need to have some medications which are helpful to us.
Could be.
But we need also the behavior and cognitive therapy to look out and search for newer savoring things which are going to be helpful for us maintain our energy levels and not get burnt.
Right. And it's a bit like lifestyle management when we tell, when folks are told about lifestyle management, like diabetes patients, like, you still want them to do lifestyle management. You won't be able to throw medicines at the problem and make it go away. So it's better.
I wanted to add quickly to that. In the United States, I could speak from that perspective. They found that there is an overuse of medication for things that can be resolved without it. And where we are trying to shift in the mental health framework is to see what can be prevented from medication or psychotropic intervention, what can be done without that, because there are side effects to medications, even the good ones. And so if we could reduce or eliminate side effects by doing this naturally, then that's the route that we try to go, especially for healthcare professionals. You don't need one more thing to add to your plate. This can be done, from your own home. It can be done without anybody even knowing you're doing it. Breathing is something that's free. We have access to it. And we, in the United States, in terms of mental health, they find that Medication now is for those when they cannot access these things without support. If someone is struggling with depression or anxiety or any of the other things that are beyond the capacity that they can handle on their own, then medication can be helpful. But we try to use the ones that are already available to us naturally, and that is our own breath and our own ability to change perspective and thinking.
Yeah, thank you.
And yoga is
Try to
a question about
I-
yoga. I'll just comment quickly. Yoga, breathing, prayer, all these things can bring up parasympathetic response. So these are all powerful. We're giving you some techniques in addition to what you may already be doing that is helpful. And the good thing about breathing is you don't need to be in a room or a center or have a yoga sheet or mat. You can do it sitting in your chair. You could, so these are things you can add in addition to your regular practices of exercise or yoga. I'm sorry, there was a question. I think you're on mute.
Yeah. So while trying to do mindfulness exercise, I felt that my mind is wandering a lot. I can't focus for more than 2 or 3 minutes. And for that 2-3 minutes also, I really have to struggle to keep my mind on that particular breathing.
Mhm.
So what is the solution? Like
My-
this, or there is something else?
So in addition to things that work for you, I know last time you shared about the poem and the poet and that activity. I would say for mindfulness, to build it up, I find that it's like training a small puppy. They start out running around and they can't stay still. And then you train your mind, and you could start small. You could start by just taking 6 seconds to savor something good that happened and then build up from there. I know for me, long meditations don't work. I do short little meditations. I do short savoring exercises. That benefits me more than a 20-minute meditation session. Everybody is different. But I know that it's something that takes practice and it can be built up, and capacity for longer stretches of focus and meditation on can build up to that point. But starting small is always a good way to go. Like I say, 6 seconds is something that most people can handle on a regular basis or a few times a day. Did you have anything more to add to that, Gitika?
Yeah, so I'll add something really quickly, and then I wanted to, mainly because I'm aware of the time, I wanted to also move to the next slide. But one thing that I definitely wanted to say, because that question comes up quite a bit about the thoughts wandering. The moment in which you notice your thoughts wander and you remind yourself to come back, that moment is the moment where you're making a difference, because you're coming back to the present moment. Oh, I noticed my mind wandered. Let me come back. So your breath is the anchor. You're remembering to come to the present moment. The breath is your anchor. And over time, you'll notice you'll catch your mind sooner. Oh, the mind flew again. So the thoughts wandering is totally normal. And we are getting the mind back to the present moment. And remembering that the wandering mind, research has also found the wandering mind is an unhappy mind. There's a paper that's called exactly this. The wandering mind is an unhappy mind. The more our mind wanders and we are unable to bring it back to the present moment, the more people start actually realizing that they start feeling very unhappy because their mind and body are in different locations. I'm working on one thing, thinking about another. So getting faster at noticing, oh, the mind's wandered, let me bring it back. So no worries. And like Ansi said, keep practicing. That's where the magic is, the training. So yes, moving to the next slide, and maybe we'll come back to questions in a few moments. Actually, I just wanted to make sure we got to this slide. So yes.
So this is another part of, we talked about taking perspective into consideration when it comes to prevention of burnout or emotional distress. Your perspective and where you place your thoughts and your expectations is a big factor in how you feel. So I talk about this concept of planting a seed. That is big in healthcare. That is big in education. in terms of knowing that you will not be able to solve all the world's problems. You will not be able to solve all the patient's ailments. You will not be able to get everyone cured. It has not happened in history that one person could do all that, or even an organization can do all that. But you are capable of planting seeds that will grow. And when you are feeling frustrated with the work, or you feel that your efficacy is not there, going back to realizing that you're planting seeds and taking that perspective can be very helpful in feeling more a sense of purpose in your work. An example that I want to give is when I worked with clients many years ago. One of the clients I was assigned to was a teenage girl who would not leave her home. She was too anxious and she was missing a lot of school. And in New York State, it's illegal to miss school. And instead of it becoming a criminal issue, they decided that, she really has bona fide anxiety. We need to send somebody to the home to help her. So I was assigned to work with her to help her anxiety so she could resume her attendance at school. I worked with her for close to a year, and her school attendance did improve. However, I was very disappointed and I did not show self-compassion. I felt that I didn't do my job, that I didn't get her to go to school 100%. Her attendance had improved slightly, but it wasn't great. I ended up having to leave that position because I moved. I happened to 2 years or 3 years later bump into her mother in public at a store, and the mother recognized me right away, came to me and said, I remember you came to our family, you worked with us. And the first thought I had is, yeah, I remember she never finished school. And I never shared that out loud. And the mother said, I want you to know my daughter is now working, and she got her what they call a general equivalency diploma. And we were talking about you recently, and we realized that you helped us. And I was in shock because I had walked away from that intervention thinking I had not done my job. I had not done well, feeling really depleted. But then 3 years later, I come to find, and just by chance, I had planted the seeds for what that family needed in order to get on the right path. And the expectation I had, this is where we go back to perspective and expectation. She should be going to school 100% of the time. But that was not what she was able to do. Her anxiety was so bad that that little bit of attendance improvement was an improvement for her. And she found a different path to complete her education. I planted those seeds, but she took the steps. It is very important to remember that you are planting seeds all the time when you are doing your best to serve patients. You will not be able to always get it 100% right. And don't necessarily think that the path you want to outline is the path that it needs to happen in order for a patient to get better. So that's one very important aspect, is when you feel frustrated, start to look at, let me see what seeds I can plant. What can I do to support in a little way, even if I can't solve the big picture? And a big, wonderful, powerful tool is reframing. Reframing is taking something and looking at it from a different angle. So it's different than planting a seed where you're looking at what little you could do in order to help that patient or client grow in some way or another. Reframing is taking a situation that is initially perceived as negative or overwhelming and finding a different angle or perspective. So I wanted to talk in a dialogue with Gitika about a situation that she wanted to reframe. And so if you could tell me, Gitika, what is a situation recently you had at work that initially posed a negative feeling for you?
It was feeling short-staffed because we have many people who left the organization. So we have fewer therapists, and there was a very huge demand for services. We had these really huge wait lists, and we were just trying to figure out how to serve all the people that we wanted to serve when we didn't have enough people or enough time in our schedule.
And how does that make you feel when you're looking at it from that angle?
Oh, just overwhelmed, and like nothing I do will be enough.
Mm-hmm. So feeling overwhelmed, feeling nothing I'll do be enough, and here's these high demands. So if we were to reframe that Could you find a different perspective of how you could look at this that could be positive?
I think after talking about it with you and with my colleagues as well, when we talked about how overwhelming it was, we were actually able to start thinking about our work in different ways, and we became more creative. I think it got us to start thinking about what are we trying to do. We're trying to serve people, but maybe we need to think about serving them in a different way, so that it's not that I'll meet everybody for 1 hour. It could be that I will do a phone call with multiple people to check what is it that they need and figure out whether I can actually refer them out to some other clinic or so I think the reframe was really, this is an opportunity to get creative.
Yes, yes. And I think there was one other thing about the fact that so many students are recognizing the importance of mental health.
Yeah.
And that they are not ignoring it. So,
Right.
so when you think about that there's so many students who want a service that will benefit them, and you have, with you and your team, opened up creative ways to meet that demand, then what do you feel?
It feels great. It feels great. I think remembering that we're actually really valued. The fact that there is a wait list means people actually want this. And at a time that so many businesses were actually dealing with nobody's coming. So
Yes.
it felt really great to feel
Right.
wanted and valued.
Right. So in that example, it is the same exact situation. The demand is high. There's not enough staff. Initially, Gitika felt overwhelmed, not enough, too much. This is too much. When we reframed it, same situation, nothing has changed. She started to bring up a different angle. We can become creative. Here is an idea of how we can meet that need. It's not the original idea, but we have a different way. And look at this, so many students want to benefit their health and they're coming to us. I feel valued. So she went from a state of feeling not enough, overwhelmed, to the same situation, making her feel valued and creative. What is fascinating about reframing is that the stressor has not gone away. The stressor remains, but the feeling and the response is one of, this is what I can control. And I went from feeling not enough to feeling a person of value. That is the feeling of professional efficacy that will help you prevent burnout. So I hope that example made sense, that you don't need to remove the stressor completely to feel relief from burnout. You can change your perspective and find relief from burnout. So I think what we'll do is we'll go into the next slide and then open up for questions afterwards, since we had a discussion point. So important to know that you are not alone. And as Gitika mentioned in her example, she had to team up and collaborate with team members in order to help meet this demand. And one of the ways to bring support to yourself after everyone becomes self-aware and takes care of themselves, peer support is very valuable. I did listen to some of the talks and presentations on burnout in physicians, which was a burnout series that was presented in the United States. And they talked about peer support being a big protective factor. So now that many of you have listened to our workshop and is now open and aware, the next step is to find peer support. It helps prevent burnout, but important factors in peer support is to keep confidentiality. It is not for you to have peer-to-peer interaction and then talk about your peers' private information to other people. You want to maintain confidentiality and make an agreement of confidentiality, whether you do one-on-one peer support or groups peer support. This opens an environment of trust. When there is trust, people are able to unload and reveal what might be bothering them, even if it's a perspective change that they need. None of these things can happen without trust. So please maintain confidentiality so you can build trust. And the big thing we ask is being non-judgmental. If someone presents to you, I'm really struggling, with the fact that I cannot help this patient, and then you say something like, well, don't be so dumb, you're perfectly smart, that's it's unnecessary you think that way. Even that is a judgment, because you're saying that they're being dumb for thinking that way. I'm giving that as a very simple example, but our judgment of others can affect their ability to trust and to open up. So please create a trustworthy, confidential, and non-judgmental space. Peer support along with self-care, it makes a big difference in resiliency. So if we could go to the next slide. So in terms of planning for your resiliency, because that's what we want to build, is resilient healthcare professionals that can be not only good for you and your health, but to serve your communities and not be overwhelmed, whether it's COVID related or not. And just a key piece of information, when I listened to the doctor's burnout workshop, they said that burnout existed way before COVID. Burnout in doctors was very strong. COVID just brought it more into the spotlight. So resiliency planning will be very helpful for COVID and going forward, because it's a demanding profession. And we recognize that. And we appreciate the work that you do. But in order to keep you healthy to serve the communities, we need to build some resiliency planning. So that can come on the individual level, the peer level, and the organizational level. And so the ProQual was mentioned in session 1. For those who didn't see it, please watch session 1 and try taking that instrument as an opportunity, the ProQual tool, to just see where you are in your levels of compassion, satisfaction, fatigue, and burnout. And it helps you realize where you should put your attention and where you need to start doing some work for yourself. Again, this is the personal level. Then with the peer support, we talked about finding like-minded individuals. If you build that trustworthy system and confidentiality, you can discuss your ProQual with your peers and find ways to help implement things for each other, reminders, accountability, a walking partner, whatever it is that would help you stay supportive to each other and help raise those compassion satisfaction scores and lower the burnout scores. And then with the organizational planning, once you have these regular practices for yourself, how can you bring these into your organization? How can you maximize the positive aspects of helping in your organization and reduce the negative aspects? Because the negative aspects of helping are going to be there no matter what, but increasing your compassion satisfaction, the positive aspects will help you buffer against those negative aspects. So having conversations possibly with leaders or maybe a group of peers coming together, again, not as demands, but as open discussions of how can we build resiliency within our organization. So all these tools together can help build a nice cushion against burnout. And next slide, please. So some of the questions we posed, and this is where we can open up for question and answer and also discussion, is how can you apply what you've learned? What are things that you can apply at the organizational level? Is there a leader that you could talk to? Is there someone or group of people at your organization who would be willing to implement things? Or is there a board that needs to be discussed with, that possibly some things can be implemented in the organization? And then who can you personally get support from to make things happen? And who can you collaborate with? Maybe it's not necessarily in your organization, maybe it's somebody outside of your organization. Maybe there's a local yoga center. It doesn't matter how that happens, but the key thing is to recognize where you are, take care of self, and then join with peers and organization to make the entire environment resilient to burnout. So I thought it would be good to open up discussion and question and answers at this point, so that we can see how we can apply any of these things, or if there's any questions on some of the exercises or techniques we talked about.
Yeah, I think let's start with Dr. Sanesh. Can you tell me, like, you are in a private practice and how you are going to apply this message of the today's session in your practice?
Right. So, yeah, thanks. Actually, I was going to ask a question that, about something that I personally face a lot, and that is about switching off when being away from work. By that I mean that there are so many times that I'm off work, I'm back home, but mentally I'm still invested into the hospital. Mentally I'm still over there. I'm still thinking about the patient, and and sometimes I'm not completely there for my family in spite of being there physically. So is there anything I can do to sort of deal with this particular situation?
I am very happy that you shared that, because many people feel that way and they just don't share it out loud. So you've actually resonated with so many healthcare professionals in that statement. And I feel, and I would love Gitika to comment on this as well, I feel it comes back to being in the present moment and putting your attention to what's right in front of you and practicing that and bringing yourself back to that. And that grows then your ability to then shut off and compartmentalize. What's at work stays at work. But it takes practice. If you're so used to having your mind there, you have to keep bringing it back here. Whatever it is that's in front of you, can you engage with that's in front of you? So for example, sometimes I feel that children are helpful in reminding that, no, you're not going to pay attention. I'm going to act out so you could pay attention to me right now. But if you don't have that, what are the other things that you can bring your attention to in the moment? It's practice. I just know my children helped me with that, because they definitely showed me a lot of things that I could do in the moment, because they distracted me with, making a mess or, acting up or being naughty. And then I have no choice but to take my mind off of work and pay attention to them. But what are joyful activities I can do with them too? What are joyful activities to do with your spouse? What are joyful activities you could do in the moment? And here's the big thing that we shared. It doesn't have to be big. It could be small little things. Maybe it is taking a walk with your child or your spouse. Maybe it's taking a walk with a pet if you have a pet at home. It's a practice. So Gitika, you want to add to that?
Yeah, I also wanted to add to ensure that you have transition time between tasks, because I know we use examples like that, where our brain is like multiple tabs of the computer are on and you just close one tab and that's it. But of course, we actually don't function like that in real life. We are people who are at work, and then we expect ourselves to suddenly switch to home and coming to the present moment with your body. I invite you to actually include a tab that's transition. So sometimes it's the commute, sometimes it's actually like taking that walk with your child, doing something very concrete, physical, that's actually helping your body come out of that stress zone that it was for work, helping the entire body come out of work zone. And a lot of times stress can pass, but the stress reaction stays in the body, and we also need to discharge that. So I usually encourage folks to either do some kind of a very concrete activity that ends up being, this is not work, this is not home, this is transition. And just like a car, we don't want to apply the brakes too suddenly. We ideally want to slow down. So we are like that, even as the human mind and the human body, it needs time to actually slow down and switch gears. So I'm going to invite you to actually consider switching by inserting a transition activity for yourself. And usually encouraging people to switch off their digital devices is one thing that, even if it's for 2 hours, if that's your transition, or if not digital devices, I mean, I don't know what kind of pressures you all, how scary it might be to switch off your digital device, but something that marks, I close the day. For some people, it's actually pouring out the water from the watering can that they drink water from. But then before they leave, they actually pour it out, sending a signal to the brain, this is done, leaving now. So for that.
A physical signal can help.
Physical signal.
It brought up a memory of someone that did this activity where they worked on a crisis hotline, very, very heavy stuff, and they were bringing it home. and did exactly what Gitika mentioned, is a physical reminder. There is a door when he exits the crisis response hotline. He pictures that when he closes that door, that he's leaving work behind, and then he walks down the hallway and he's dropping all the things on the hallway. And then when he exits the building, that last bit of close of the door is it for today. So that physical reminder that when I close this door, I'm leaving this here, I come back to it tomorrow. And that started to work for him, and he wasn't bringing all the stressors from the crisis hotline home.
Okay, thank you.
I have a question.
Yeah,
You know,
yes, Dr.
sometimes
Gupta.
it's sometimes easier to think of it rather than doing it. Let's say you are in a situation where you operated on a patient and there is some complications. So you're always thinking about that, even if you're back home, that look, what is going to happen, even if you're off duty. But since you are one of the team leaders of that surgery or whatever, so how to overcome that? Because the moment you're home, you're again thinking about the same thing. And I mean, it's very difficult for me. And I'm sure Dr. Trikha and Dr. Dhiren will echo the same thing. So how do you think you should tackle that?
I feel like that's a very concrete example of the kind of things that create secondary trauma. That that you never stop thinking about the pain, and you never stop thinking about all the things that you could do, because you are trying to be creative and trying to actually make sure that you did all the right things as the team leader and that the patient is also safe. And I think that's where I typically have invited the serenity prayer into the room, recognizing all the things that you could have done that were in your control, and recognizing also the things that were not in your control and that may not be in your control. The biggest cause of burnout in my career had been, I used to work with kids who used to, in the US, they have the foster care system, and kids used to are taken out of their families and put into a different system. But a lot of the burnout had come from realizing that no matter what I did, kids were constantly getting taken out of their families' homes and put into a foster care system. And I remembered feeling that my burnout at the heart of it had come from recognizing that there is some point at which I am powerless. And I think it's a very spiritual practice at some point. And that's where burnout healing also has a very strong spiritual component. The serenity prayer at the heart of it is a reminder of how do I accept the parts that I'm powerless around? And what can I give myself permission to surrender around the things that I realize I can't control? It's painful, of course. We care for our patients. And it's obviously not something that, in 3 minutes, like, Dr. Gupta, just do this, but I'm inviting you, Dr. Gupta, to kind of, I just hope you find that peace somewhere in your mind to realize that when you do your best, that's great. And then at some point, some things are out of your hands and that's not your fault.
Yeah, I agree.
So,
But no, my question is like how to get out of it.
Yeah, exactly.
I agree.
Same thing
It
for
is-
me. Same thing for me is my question was, how do I balance your serenity prayer? My name is Vivek, and Vivek means the last word, wisdom to know the difference in Indian Sanskrit words.
Right.
So how do I balance that Vivek with that drive to excel in my profession, which I think is the main cause of our burnouts as an individual, besides the clinical? How do I balance that? That's very difficult to understand and to do that in a life. I think whosoever does that to the maximum is the one who is the least stressed out person.
And I think it goes back to the practice and the reframing that I described. The stressor, like I said, will never be stress-free, will never be problem-free. You'll not solve everything, but practicing taking those different perspectives, practicing those other tools will help you balance. And it doesn't have to be either or. You can be driven and have excellence in your care, and still you'll lose a patient. It happens. You can be excellent and you can provide you can have the #1 medical school in the country, and you will still lose patients, because that's what comes with healthcare. I work very hard with my patients, but there are times where I have a patient who becomes hospitalized from their psychiatric symptoms. I did my best. So it's letting go of being able to control every aspect of it, knowing you did your best. And then the big one we talked about, compassion to self. Please allow yourself compassion to know you did your best, and you cannot control every aspect of it. And that is how you balance it. The big thing with all of these exercises is none of them is a quick fix. None of them is like a light switch that, oh, okay, once I do it, it'll work. It takes time. I've been practicing for 10 years. And that is how, when I have a crisis at work and something goes wrong, I don't become devastated, because I've been practicing for 10 years.
Yeah, definitely.
I think already our time is just over. So at the end, I would really like to thank all my panelists for giving their valuable input. And I know that there are a lot of difficult questions, and still there are questions which are not answered. But I really appreciate both NC and Gitika. They tried their level best to help us to understand the situation and how we can overcome those problems. I know that definitely we can have something more to discuss in the third session also. So I will request Indian Orthopaedic Association to have more session on this topic, because this is really a genuine problem and we really need to understand it better. So with that, I thank our audience and Indian Orthopaedic Association, Ortho TV and IOA TV for giving us the technical support for this session. And last but not the least, I must thank INDEAR for their valuable support and guidance for the program. We are really fortunate to have NC and Gitika with us. And without that, this program would not have been possible. So thank you everyone once again. And with that, we end the session.
Thank you.
Thank you.
Yeah,
Bye.
bye-bye.
Thank you.
Bye.
Bye.